I'm here at the MOASC meeting presenting the updated results of the MMO02 trial, which is a combination of different cohorts looking at mezigdomide with proteasome inhibitors, bortezomib and carfilzomib. We presented preliminary efficacy from this phase 1/2 dose escalation trial along with safety, and we're encouraged by the response rates. The overall response rate across all of the cohorts was at least 75%. Cohorts A and C in the trial had a slightly later line patient population, along with cohort D, which was a dose expansion of the bortezomib arm, which had a larger number of patients and a slightly earlier line patient population. The overall response rates in combination with bortezomib in the dose expansion, as well as in the combination with carfilzomib, were over 85%. And the median PFS that was presented with this longer-term follow-up was encouraging. In the dose escalation for the bortezomib combination, it was a little bit above 12 months. When we look at the dose expansion for mezigdomide with bortezomib, the median PFS was 17.5 months with the median prior lines of therapy of 1. And the median PFS in combination with carfilzomib in a patient population that was predominantly LEN and anti-CD38 exposed was 13.5 months. We know with the CELMoD agents, by targeting Ikaros and Aiolos degradation, that an on-target effect is neutropenia. We see an arrest of neutrophil maturation. And so this is a recognized on-target effect for the CELMoD agents, and here we see that with mezigdomide. However, grade 3/4 neutropenia was manageable with G-CSF use, and it was supported with dose interruptions as well. Part of the mechanism of action of CELMoD agents is to degrade both hematopoietic transcription factors, Aiolos and Ikaros, and so we had seen a decrease in Aiolos over time, suggesting that there's a degradation of this target protein, which was seen pharmacodynamically in both T cells as well as in myeloma cells, as the presentation had presented. We're very encouraged to be supporting 2 randomized phase 3 studies looking at these exact combinations. The first is called Successor-1, which is looking at mezigdomide in combination with bortezomib and dex versus pomalidomide, bortezomib, dex in patients with 1 to 3 prior lines of therapy with relapsed refractory multiple myeloma that had prior lenalidomide exposure. The second trial is called Successor-2, which is a combination of mezigdomide with carfilzomib and dex versus the doublet of carfilzomib and dex in patients with at least 1 prior line of therapy, and this relapsed refractory multiple myeloma must have had prior exposure to not only lenalidomide but also an anti-CD38 monoclonal antibody. So taken all together, we are encouraged by this preliminary signal with the phase 1/2 trial and hope to see the results of the randomized phase 3 trials reading out very soon.